I'm Stuart Ritter, Retirement Insights Leader at T. Rowe Price. Love the music on that intro. I'm thrilled to have all of you with me today to talk about an important subject that a lot of people try to avoid. They actually don't want to talk about it because they think healthcare is a six-figure word. Unfortunately, I'm here to tell you that it's not. And this presentation is a way for you to talk about a very important top-of-mind subject with people who sometimes are so scared of it, they don't want to have that discussion. But by the time we're done, you'll know how to have that with them. I'm going to talk about three things. I'll talk about what people are hearing about healthcare costs in retirement. I'll talk about what's really going on, and that's where we'll spend the bulk of the presentation. And then I'm going to spend some time on what to do about it. Once we understand what the problem actually is, well, then we're in a better position to decide what solutions would make sense. So let's start with what people are hearing about what they're going to have to pay for healthcare costs in retirement. We all know the answer to this. They're hearing that it's an enormous number. Some of the numbers that are put out there, $311,000, $325,000, almost $400,000 is what people are being told they're going to have to write a check for the day they turn age 65 and move into retirement. And this big, scary number, well, that's why people think it's a six-figure word. The fear that it inculcates in people has resulted in two of the top three fears for retirees are their health insurance premiums and their out-of-pocket costs. That's what people are worried about when it comes to the transition into retirement. Now, the problem with people thinking that it's a big, scary number, that it's this six-figure dollar amount that they have to write a check for the day they turn age 65 is, first of all, it's misleading. It doesn't actually give them a real understanding about how retirees actually experience healthcare costs in retirement. It's also overwhelming. When people look at their account balance and think that almost $500,000 has to go just for healthcare costs, they're done with the conversation right there before it even happens. And lastly, it's unmanageable. When someone thinks it's some giant lump sum, some big scary number, they don't know what to do about it. It limits the solutions that we as professionals can talk to them about. It's hard to build a financial plan when someone thinks they just have to write a big check. It also skews people's perception of the risks that they face when it comes to healthcare and retirement, what they might have to pay and when they might have to pay it. And if people don't understand the risk, it's really hard to build a plan to address those risks. Now, fortunately, the reason I'm here sharing this with you today is that it's not a big, scary number. And I'll give you three reasons why it's not a big, scary number. Reason number one, it's not a lump sum. Nobody shows up at your doorstep the day you're 65 and says, okay, give us all the money now that you're going to pay over your entire retirement for healthcare. Think about it. We don't show up at a 27-year-old employee's desk the day they turn 27 and say, happy birthday, you have to write a big check now for all the healthcare costs you're going to experience for the rest of your working life. It's not how we do it when people are working. It's not how it happens when they're retired. Nobody shows up and says, you have to pay $86,000 for all of your internet access for the rest of your retirement. I mean, that's what $150 a month would work out to, but that's not how people experience expenses in retirement. And that applies to healthcare expenses as well. Number one, it's not a lump sum. Number two, it's not a big scary number because you is not we. The numbers you see out there are almost invariably associated with a couple, two people. And yet many folks see that dollar amount and think it applies just to them, and each person has to pay that amount. Not true. And lastly, number three, those dollar amounts you see aren't even remotely average. They are not what the typical retiree pays for healthcare costs in retirement. As a matter of fact, one of those numbers you saw, the way that number is created is somebody looked at what a retiree would pay if they had to pay for medical expenses an amount that was higher than 90% of all the other retirees. And then they took the dollar amount that was higher than what 90% of all retirees pay for prescription drug costs. And then they added those two numbers together, even though it's not the same person. So the numbers we see out there aren't even remotely average. So these three reasons are why it's not a big scary number. Which begs the question, if it's not a BSN, what is it? And that's what we're going to get into. We're going to talk about what's really going on when it comes to healthcare costs in retirement. And we'll look at three areas. First of all, we'll look at what retirees spend on healthcare versus everything else they spend their money on in retirement. Second, we'll look at the fixed expenses that retirees encounter when it comes to healthcare costs. And lastly, we'll spend most of our time talking about the variable expenses, what people are paying out of pocket. So let's start with healthcare versus everything else. So we looked at Bureau of Labor Statistics data, and I put together a chart that you see on your screen. And for this chart, I actually took out the early retirees. So this is Americans over age 75. The first 10 years typically of retirement, took that out. We're looking at what people spend when they're over age 75. So this is the average person over age 75, Bureau of Labor Statistics data. And it turns out of all their expenses, a little more than 1/3 goes to one particular category. So we're going to bring up a poll, and I'm going to ask you, it's multiple choice, help you out here. What is the biggest expense category for the average retiree each year in retirement? Alphabetical order, entertainment, food, healthcare, housing, transportation. So those are your five options. What do you think is the biggest expense category for retirees over age 75? All right, let's take a look at the results. And Brian, forgive me, I can't actually see those results, but that's okay. I'll tell you what the answer is. The actual answer is housing. Anybody surprised? I was. With all the headlines we get about how much healthcare is going to cost in retirement, the fact that that's the two of the top three concerns for retirees, that's where most people's attention is. But in reality, the vast majority, or rather a little over 1/3 of what people spend if they're over age 75 goes to housing. All right, so let's take a look at poll question number 2. I now have on the screen the second and third biggest expenses for Americans over age 75. And it's also a multiple choice question. I'm going to give you a hint. It's not housing. You get to pick two of these choices, same alphabetical order. What would you say are the second and third biggest expenses for retirees over the age of 75? Entertainment, food, healthcare, housing, it's not housing, or transportation.
Stuart, I was going in and read the poll numbers off for you. So the first poll, we had 75% around the housing. And we're looking at 7 on entertainment, 14 have selected food, 9 have selected healthcare, 3 on transportation, and 1 on housing.
All right. Well, here we go. Second and third biggest expenses, and some of you got the combination right. Healthcare and food. People spend about 16% on healthcare and 13% on food. So let me make 2 observations here. The first observation I'd make is not only is healthcare not the number 1 expense for people over age 75, it's the second biggest expense by less than half of what people spend on housing. And they spend just about the same amount on food. And we don't hear about food as a big scary number, and yet it's the same area that healthcare is. And then everything else fills in the rest of that pie chart: transportation, entertainment, clothes, etc. So the first point of this presentation is the number one expense for people over age 75, not even all retirees, is housing. And that might put healthcare in a different context for the folks you're talking with. All right, we hear that the costs for healthcare go up as people age, so let's take a look at that. I'm going to bring in my 65 to 74-year-olds now. We'll look at what they spend, and we'll compare it to spending for people over age 75. And what we see is, indeed, healthcare spending does go up, but that's not the whole story. What people don't realize is while healthcare spending goes up, spending on all those other categories, including housing, which is the biggest one, goes down. So a number of people have the impression that their healthcare costs increase on top of steady spending in all the other categories. But actually, as healthcare spending goes up, other spending comes down. So organically, overall spending actually decreases as people move from 65 to 74 into that 75 plus range. All right, I want to talk about actual healthcare spending. And to help me do that, I'm going to use a deck of cards. Stay with me. If I put a deck of cards out on the screen in front of us, black suits to the left, red suits to the right, this is what it looks like. And if I were to draw a line at the 50th percentile, that's that formal term you got in 8th grade statistics class, if I were to draw a line where half the cards are to the left and half the cards are to the right, that line is at the king of clubs. That's the 50th percentile. If I were to draw a line where 95% of the cards are to the left, that line is at the queen of hearts. I'm rounding off, illustrative purposes, you get the idea. But the point is, if I were to shuffle the deck and pull out a card at random, half the time I'd get a black card, 50% of the time. So my 50th percentile, the number at which, the point at which half the cards are to the left and half the cards are to the right, and this illustration is the king of clubs. So let me bring up our third poll. If I were to draw a line where half of what retirees spend on total healthcare spending per year, draw a line where half of retirees spend that dollar amount or less, and half of retirees spend that dollar amount or more, what is that dollar amount? Is it $3,400, $6,800, $10,100, or $12,500? What's the dollar amount where half of retirees are spending that amount or less each year in total healthcare spending?
Pretty neck and neck. We have $3,400 is leading the way with second place of 5, going at 68 currently right now.
Okay. Look, those of you who selected $3,400, congratulations. That's what the average retiree spends in total healthcare costs each year. It's not a six-figure word. It's $3,400. Half of retirees spend that dollar amount or less in total. Now, I know nobody's worried about the average. People are worried about, if I shuffle this deck and I pull out that queen of hearts, what's that dollar amount? Well, the dollar amount that's higher than what 95% of retirees spend is $10,100. Still not a six-figure number. And this gives people a better sense of what that would be. Part of it is it's an annual cost because that's how people incur their expenses in retirement. Now, for most people, that illustration, that analogy I used is essentially how it works. They shuffle the deck, they pull a card out. If they get a black card, they're paying $3,400 or less that year. If they happen to get a red card, for 95% of people, that's a one-time bump in expenses. The next year, they're pulling randomly from the deck again. So for most people, even if they got a red card, it's not a permanent increase. They go back to a 50% chance of pulling a black card the following year. So let's look at fixed expenses. And there's one key aspect of fixed expenses that I want to make sure you know. And that is that about 3 out of every $4 that a retiree spends on healthcare is fixed. It's Medicare premiums. And the fact that most of what they spend is a fixed amount means that it's essentially knowable in advance, it's budgetable, can be managed out of cash flow. It fits into the overall holistic retirement planning that we're already doing for people. It's not as if, we're going to put a retirement plan together and then we need a completely separate healthcare plan because that sits over here. healthcare fits in. 3/4 of what people spend is a known quantity ahead of time. It will go up each year for inflation, but we have a general sense of what it is. It's the second biggest expense in total, so we can work it into the help we're already providing for people once we understand that the vast majority of it is a fixed expense. All right, let's take a look at the variable expenses, because I know that's where the concern comes from sometimes. We're going to look at two aspects of it. We'll look at annual expenses, just as we've been doing, but then we're also going to zero in on end-of-life expenses. So in this case, it's what people spend out of pocket. We're going to take that Medicare premium, we're going to set that aside, that's fixed, we know what it is. Now we're just talking about the out-of-pocket costs. For end-of-life, it's the out-of-pocket costs for the last 2 years of life. So 2 years and the last 2 years of life, because those tend to be the most expensive. But we'll start with variable expenses from on an annual basis. This one I'm going to break up by age. So annual variable costs for people who are in their 60s and 70s, that median amount, the 50th percentile, dollar amount at which people spend that amount or less, half of them spend that amount or less. In their 60s and 70s, it's $1,000. In their 80s, it's $1,000. In their early 90s, that number is $1,000. And in their late 90s, the median amount, the average amount that retirees spend for out-of-pocket costs is $1,000. Now hold on to that for a second. I'm going to summarize in a minute. Let me go back to the 60 and 70-year-olds, and let's talk about that Queen and King of Hearts. If somebody has an expense in their 60s or 70s where their out-of-pocket costs are higher than the cost experienced by 95% of everybody else in that age group, in their 60s and 70s, they're paying $7,000. In their 80s, if they have an expense that's higher than 95% of all the other 80-year-olds, it's $13,000. In their early 90s, it's $33,000. And in their late 90s, it's $42,000. So finally, we're seeing some of those big numbers that we knew were out there. So this presentation is not to say there aren't people that spend a large amount on healthcare costs. What's important to understand, and I'll summarize this in this table right here, is there are two key points. First of all, for the average retiree, the amount they spend out of pocket is not only a modest amount, but it does not increase as they age. Where we do see the big numbers are for people who have an expense that's higher than 95% of what all the other retirees at their age are spending and are living into their 90s, especially their late 90s. So here's an important implication of that I want you to think about. If we are talking to a 65-year-old, for them to experience that $42,000, for example, two things have to happen. One, they have to have that expense that's higher than 95% of every other person in their late 90s. And number two, they have to live to their late 90s in the first place. And for the average 65-year-old male, that's a 1 in 4 chance. For the average 65-year-old female, it's a 1 in 3 chance. So I'm gonna average some things out and summarize, but the point is, if we're talking to a 65-year-old, the odds of them experiencing that $42,000 is as if we took 2 decks of cards, one with a red back and one with a blue back, and we shuffled 2 decks of cards together, and they would only experience that $42,000 if they pulled out just the King of Hearts with the red back. They pull any other card and they're paying a lower amount. So the high dollar amounts are out there. At the same time, there are very, very few people who actually experience them, and usually it's folks who are in their late 90s. So let's look at this from another perspective. Let's look at that end of life expense. So we just looked at annual costs. Again, this is the last 2 years of life out of pocket costs. And I'm going to summarize because we're going to see the same kinds of patterns. 60s and 70-year-olds, 80-year-olds, 90-year-olds, a fairly modest amount for the most expensive healthcare part of someone's life over the course of 2 years, $3,000, $4,000, $5,000. Half of people at those ages pay that amount or less. For the folks who have an expense that's higher than what 95% of people at that same age are paying, we see the same pattern. And here we finally see a 6-figure number. Again, It's end of life. It's for people generally in their late 90s. And I'll tell you where it comes from. It comes from long-term care costs. So let me be very clear about who's included in this and who's not included in this. So one of the groups that we excluded from this analysis, knowing that what drives those big numbers is paying for long-term care costs, is we actually removed the people who are on Medicaid. Because people who are on Medicaid don't pay their long-term custodial care costs out of pocket. It's paid by Medicaid. So the people you're seeing here are the folks who are above that Medicaid threshold. So they're actually paying that money out of pocket. So we're just looking at people who are actually incurring these expenses. There's not, for example, a bunch of zeros thrown in because we included people who are on Medicaid. We took the folks on Medicaid out of this analysis. Now, same thing that I talked about earlier, for someone to experience that six-figure dollar amount, if they're 65 years old, they need to both live to their late 90s and have an expense that's higher than 95% of everybody else out there. Now, I'm going to pause here because if I asked every single person on this presentation, if you can think of somebody who is paying a fairly high dollar amount, probably for long-term care costs, everybody, I'm sure, can think of someone. I know I can. If I were to ask you, though, to give me the names of 5 or 10 or 20 people that fit that category, you'd probably have trouble coming up with it. And the person you can think of who's spending that amount of money, to some degree, is the exception that proves the rule. The vast majority of retirees don't pay these six-figure dollar amounts. They don't end up paying a large amount for long-term care costs. There are a few who do, and we all think of them. At the same time, it's important not to generalize the one or maybe two people we can think of as representative of the experience of the typical retiree, because that's not what they experience. As a matter of fact, we'll break this up by gender now. What we see here is that even if we look at males and females, at the median, half of each gender pays the dollar amount that you see or less. For the folks who are paying 95% or more, are paying more than what 95% of what people within their gender and at their age are spending, this is where we see those big numbers again. And this is where we see a distinction between males and females, especially for folks who live to their late 90s and incur expenses higher than what 95% of everybody else of their gender and their age incur. That's where we see the distinction. So it's important to understand how it can vary by gender and when that variation gets big. The last thing I want to show you is the long-term care costs I talked about earlier. The average person pays $0 for long-term care costs. The 50th percentile, half of people pay $0 for long-term care costs in the final 2 years of life. As a matter of fact, that dollar amount is zero up to the 75th percentile. 75% of retirees pay $0 all the way through their 80s, and in their 90s, it's some fairly nominal amount, a couple of $1,000s, that's it. But at the 95th percentile, for folks who have a long-term care cost that's higher than what 95% of everybody else are paying, and again, we took Medicaid out of this, that's where you see these big numbers showing up. The last piece we want to look at is really, to some degree, the concern that people have. It's not so much the dollar amount. It's, will my spending on healthcare use up all my money, especially if I have a spouse who's going to be left behind if one of these things happens to me. So what we're doing in this section is taking the dollar amounts you saw in the previous section, and we're dividing them by people's assets. And here's what that looks like. The percentage of net worth spent at the end of life, last 2 years, most expensive spending on healthcare costs, it's low single digits for the typical retiree at the median, 50th percentile. For the folks who have an expense that's higher than 95% of everybody else, it's 40%, 60%. The 135% is when someone incurs an expense that's higher than the assets they actually had. And that generally hits folks who are just above that Medicaid cutoff. So it's folks who have enough assets, they're not on Medicaid, but still fairly modest assets. So when they incur that dollar amount, it uses up more than those assets. So this is very sensitive to how much in assets people start with, as well as what their age is, as well as whether or not the expense they incur is higher than what 95% of people are incurring. So let me summarize how retirees actually experience healthcare costs, because it is not a big scary number they have to pay for the day they turn age 65. It's not even the largest retirement expense. As we saw, the second biggest expense, and it's on the same level of spending as food. It's an annual expense. It's mostly fixed. And of the out-of-pocket costs that people pay, at the median, it's a modest amount for all ages. Now, at the same time, a very few people will experience high costs, usually in their late 90s. So it's important to understand how retirees actually experience the healthcare costs. It's not something, those big scary numbers that we hear about, that every retiree is definitely going to experience. The picture is very, very different. So let's talk about what to do about it and how we can help people. Once they understand what's really going on, address it. So the first thing to do is understand the cost, and we just did that. The second thing to do is understand the person. Who might be on their wellness team? Who might help them if a health event happened? Do they have somebody that can provide some care so that they don't have to pay for it, and that lowers some of the expenses? And the same with an advance directive. If someone has decided, for example, they don't want extraordinary life-saving measures at the end of life, that has an influence on how much they might pay. And then what are their personal circumstances, their risk tolerance, their desire to use insurance or not use insurance? Understanding the person puts us in a better position to help people put some solutions in place. And let's talk about those. There are three areas that people can think about when it comes to addressing the healthcare costs: funding, investments, and insurance. The funding is not just how much money is available, but what account is it in? If it's all in a traditional account and every withdrawal is taxable, that's one thing. But if they have a Roth account or an HSA available where they can make tax-free withdrawals if they're qualified in case they get one of those red cards and have a spike in expenses, well, that helps them manage how much of their Social Security might be taxed, or what their Medicare premium might be, or what tax bracket they may be in. How are they invested? If someone is thinking about the bigger expenses that might happen later in retirement, do they have adequate equities in order to be able to have the potential growth they might need to have that asset pool at the end of life? And what insurance might they be interested in? Medigap insurance or long-term care insurance? And thinking about those things within a retirement plan can help people. We have a visualized retirement program that helps people think about retirement, including who might be on their wellness team, and looking at what withdrawal options are available in a retirement plan in terms of a systematic withdrawal plan or ad hoc withdrawals in case they have one of those spikes, helps people understand how prepared they are and what they might be able to do when those healthcare expenses show up. We have a variety of resources available. And what I want to leave you with is the recognition that paying for healthcare costs in retirement is not a one-time decision. Like everything else, people reevaluate every year and adapt to what happens. And what I hope is this presentation has given you a better understanding of how retirees actually experience healthcare costs and puts you in a position to help them no matter what may be in the cards for them. Thank you very much.
I did want to add, I had two questions if you wanted to answer correctly. So I'm going to go ahead and share media, and you're going to be able to see the questions, and then I can read them off as well. So I'll share my screen here.
Okay.
And then I'll make that bigger. There, can you see the two questions?
You know what? I'm on the PowerPoint, so if you want to read those to me,
You got
that would be helpful.
Here we go. So Greg Greenfield asks, do you think that if the federal government is able to negotiate with the RX companies, that then estimating the cost of Medicare Part D will be a more predictable exercise on a yearly basis?
Greg, that's an awesome question to which I have no answer. I'm sorry. I really being able to predict what the government might do and how it might change things and the impact that would have and what else might happen. That's not something, unfortunately, that I can look into a crystal ball and see. So what I can share is what's been in this presentation, which is looking at how retirees are experiencing healthcare costs now. And if we understand that better, that puts us in a position where we can apply solutions. And that way, if you've got somebody who wants to talk about what may change, you're working from a baseline that starts with what's really happening right now.
Perfect. And then our second to last question is, are these aggregate or annual cost?
So what you've been looking at throughout most of the presentation, as it says on the slide, is their annual costs. So it's what people spend each year, the one exception being the end of life costs. And those are over a 2-year period at the end of someone's life. So what you're looking at, the $3,400 a year for total healthcare spending, the $3 out of $4 for fixed expenses, all of that is annual costs. Now, if you or anybody else wants to delve into this in detail, we have a whole bunch of white papers that get into a lot of the details of this. We've got a wonderful PhD researcher who delved into the data, pulled out the analysis. I'm just having the opportunity to deliver it to you, but we're happy to share any of the details that you might be interested in. Just get in touch with your T. Rowe Price representative. We'd be happy to help.
Perfect. And then the last question from Timothy is just asking for the presentation PowerPoint. Can you just reach out to someone from T. Rowe Price? Is that right?
That's right. And we'd be happy to share that with you. And then any of the other resources we have available, including the white papers this was built on.
Perfect. Thank you so much, Stuart. We appreciate your time. And thank you, everyone, for attending. Have a great rest of your weekend. Thank you very much.